Hello, my name is Jorge Cortes from the Department of Leukemia at MD Anderson Cancer Center, and I'm here to discuss some of the frequently asked questions regarding the management of patients with chronic myeloid leukemia. One question that I frequently get asked is about the definition of the different phases of CML, and of course importantly is how do you define chronic phase CML. And this is actually, even though it sounds like a very simple thing, it is important to discuss because there are unfortunately different definitions for chronic phase chronic myeloid leukemia. There are definitions, for example, that there's a definition that started at my institution, the MD Anderson, and that has been around for many years. That's also been adopted by the European Leukemia Net. That is a definition that I follow, but there are other definitions, such as the definition by the WHO, and the definitions by the CIBMTR, the International Bone Marrow Transplant Registry, and many others. The main reason why I follow the definition that was established at the MD Anderson and supported by the European Leukemia Net is because all of the data that we have today with the use of tyrosine kinase inhibitors, so for the last 10 years, all these drugs that have been developed and that we use extensively, the data that we have is based on these definitions. So because we have data and we know what it means with those definitions, it is important to maintain those same definitions. So what is the definition then for the chronic phase based on these criteria? It means that the patient must have less than 15% of blasts in the blood or bone marrow. It has to have less than 30% blast plus promyelocytes in the bone marrow. That the patient has to have less than 20% basophils in the blood or in the bone marrow, and that the patient must have more than 100,000 platelets. Now, in some patients, they could have less than 100,000 platelets related to treatment. So if it is unrelated to treatment, if the platelets are less than 100,000, and this is unrelated to treatment that we think is related to the disease itself, then that patient is not considering chronic phase. That is one of the criteria for accelerated phase. So those are the criteria that we follow today, and again, because they are based on data, based on the data that we have for the tyrosine kinase inhibitor, that is the criteria that I recommend and that I follow for all my patients. Thank you for your attention.